Welcome to the Indiana University Health University Hospital Breast Imaging Center. Your doctor has found an abnormality on your breast imaging today that requires a biopsy. A biopsy is a procedure that uses a needle to take a tiny amount of tissue from the abnormality in your breast to send to the pathology lab. The pathology lab examines the tissue under a microscope in order to determine if the abnormality is cancer. Most breast biopsies are benign or not cancer. However, it is important to determine the diagnosis in order to start any treatment that might be necessary. A biopsy may seem scary, but it is not as scary as it sounds. It is okay to feel nervous. It often helps to know ahead of time what's going to happen. The goal of this video is to explain what to expect during your biopsy. Your biopsy will be performed using ultrasound guidance by a radiologist. A radiologist is a type of doctor specialized in reading images such as mammograms, CT, MRI, and ultrasound, as well as using imaging to perform minimally invasive procedures. Ultrasound is a type of imaging you may be familiar with that doctors use to look at babies during a mother's pregnancy. Ultrasound allows your radiologist to see where an abnormality is and direct their needle to this area. This technique is less invasive, faster, more comfortable, and provides a quicker recovery than a surgical biopsy. On the day of your appointment, you will arrive at the Breast Imaging Center at University Hospital just as you did for today's imaging. Take the outpatient AOC elevators to the second floor where you will check in at the registration desk. When the team is ready, one of the breast technologists will call your name and take you back to the consult room to change into a gown. A breast technologist is a person specialized in taking mammogram and ultrasound pictures and assisting the radiologist during procedures. After you change into a gown, your doctor will meet with you in the consult room. The doctor will ask you if you are taking any blood-thinning medications and if you have any allergies. He or she will also have you sign an informed consent paper. Signing the informed consent paper means that you are okay with having a biopsy performed and are aware of the risks and the benefits. You will also have time during this meeting with your doctor to ask any additional questions that you may have before your biopsy. Afterward, your breast technologist will take you back to the procedure room, much like where you had your imaging performed today. You will be lying flat on your back for this procedure with your arm extended up behind your head. Patient comfort is our top priority, so feel free to let us know at any time if you are uncomfortable. For knee or back pain, we provide pillows for extra comfort. Next, your doctor will use ultrasound to scan your breast and locate the abnormality. He or she will use a washable marker to mark your skin. Surgical soap will then be used to clean your skin. Sterile towels will then be draped over your chest, exposing a small window for your doctor to perform the biopsy. The doctor will tell you that they are going to numb your skin and that you will feel a sting and a burn. This discomfort will quickly go away and then your skin will be numb. If you feel any sharp sensation after this, just let your doctor know. They have plenty of extra numbing medicine in case you feel any discomfort. Using ultrasound guidance, your doctor will direct the biopsy needle to the abnormality. The needle is a special vacuum-assisted needle that uses slight suction, just like your vacuum cleaner at home. The suction helps take tiny samples of the abnormality. This is an example of what the needle sounds like. You may feel some pressure sensation with the vacuum. Feel free to let your doctor know at any time if you are feeling pain and they can give you more numbing medicine. After the samples are taken, your doctor will place a tiny marker in the area that the biopsy was taken. The marker is approximately the size of a sesame seed. The marker is made of titanium and you will not know that it is there. The marker shows up on your mammogram, indicating the area that was biopsied, which will be important for the radiologist to see on your future mammograms. This marker may also be very important should the area biopsied require additional treatment such as surgery. The marker is safe to have in your breast and will not cause any trouble with airport security or other imaging studies such as MRI. After the marker is placed, your procedure is complete. Your doctor will apply special sticky bandages called steri-strips and a larger clear bandage over the area. No stitches are needed. The breast technologist will then take you to the mammography room for a post-biopsy mammogram. This mammogram checks the location of the marker and serves as a comparison for your future mammograms. After your mammogram, you can change back into your clothing, and once the radiologist has looked at your mammogram, you can leave. You you are free to drive yourself home. A post-biopsy instruction sheet will be given to you, and your radiologist or technologist will go over the instructions as well as answer any additional questions. Things to expect afterward can include bruising and soreness. If you experience these symptoms, you can use an ice pack as needed for pain relief, or take whichever medication you would normally use for a headache, such as Tylenol. We will provide an ice pack and some Tylenol in your care package to take home with you. We recommend wearing a soft supportive bra for 1 day after your biopsy. The tiny hole in your skin from the biopsy should heal within a few days. We ask that you keep the outer bandage on for 24 hours after your biopsy and avoid getting the area wet during that time. After 24 hours, you can remove the outer bandage and bathe or shower as you normally would. Underneath the bandage, you will see the steri strips. These should stay on for at least 1 week. They will then either fall off on their own or you can peel them off like a Band-Aid. We ask that you take it easy for 1 day after your biopsy. Let your radiologist know if you have a job that includes heavy lifting, and they can tell you which activities are okay for you to perform at work. While the risks of the procedure are low, anytime a needle is used in a patient, there is a risk of mild discomfort, bleeding, and infection. We will do everything we can to reduce these risks for you. Things to watch out for after your procedure include redness, swelling, more pain than expected, or any unusual symptoms. Our phone number will be given to you for any questions or concerns after your biopsy, or if you have any serious concerns such as severe pain or uncontrolled bleeding, we ask that you go to the nearest emergency department to be evaluated. The results from your biopsy will take about 3 to 7 business days to return from the pathology lab. You will receive a phone call from your radiologist as soon as they have the results. As a patient at Indiana University Health, your comfort and care is our top priority. If you have any questions at any time, feel free to ask. If there is anything that we can do to make your experience better, just let us know. We thank you for choosing Indiana University Health, and we look forward to taking care of you.